Cross-cultural concepts of health and illness. All cultural groups view health and illness as a dynamic relationship between the individuals and their environment. However, the definitions of health and illness and their causes often differ dramatically from group to group. Some cultures view health as a reward for being good and illness as a punishment for being bad. This view is very common in Eastern cultures and in some less economically developed countries, where the locus of control for illness often is centered outside the individual. On the other hand, in Western cultures, the cause of illness is usually centered on the internal locus of control, implying that the individual has control over behaviors and also is responsible in some way. In this course, we will not be debating the causes of illness and disease. We want to understand and acknowledge what health and illness mean to the different consumers of healthcare services. So let's look at different ways of defining health. The World Health Organization defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease. Florence Nightingale defined health as being well and using one's powers to the fullest extent. Consumers also have their own perspective on health. Being able to do what I want to do. Being able to use all of your body parts in the way you want to. Being able to perform your normal activities, such as working, without discomfort and at an optimal level. I would define health as an undefined term. It depends on the situations, individuals, and other things. The concept of health also goes beyond feeling healthy to also looking healthy. That means that health is also tangible. Shiny hair, clear eyes, smooth skin, pink gums, good posture, being at a good weight, etc. The emphasis in healthcare delivery is shifting gradually from acute care or sick care to preventive care. This is being driven by the need to contain healthcare costs, and it should be noted that the country lacks a prevention model. Furthermore, very small amounts of federal healthcare spending is allocated to prevention. The top 12 health concerns in the U.S. are access to care, healthy behaviors, chronic diseases, environmental determinants, social determinants, injury, mental health, maternal and infant health, responsible sexual behavior, substance abuse, tobacco use, and quality of care. Let's now look at different theories of health and illness. The two major theories of health and illness are a personalistic explanation and a naturalistic explanation. Let's first look at personalistic explanations. These view health and illness as resulting from a person's spiritual beliefs or behaviors. Illness is seen as a violation of a social or religious taboo or having a supernatural cause. Supernatural causes include obeah, roots, voodoo, witchcraft, or sorcery. Examples of supernatural causes of illness in Hispanic cultures include susto, fright or sudden death, and fear causes the soul to leave the body and leads to extreme stress and depression. There's also the evil eye or mal ojo. Harm is caused when someone stares at the person or his or her property. Naturalistic explanations view health as harmony between a person and his or her environment. Illness occurs when this balance is upset. And within the naturalistic explanations, there are vitalistic systems built upon the ideology that illness is caused by an energy imbalance. Disease is a result of an imbalance in vital energies, which distinguish living and non living matter. Vitalistic systems include Ayurvedic medicine, Chinese medicine, and humoral medicine. Ayurvedic medicine was developed in India and still actively practiced there. The system links the body's chakras or energy centers associated with organs of the body with primal forces such as prana, agni, and soma. Three primary purposes or doshas govern the body. And good health is experienced when the doshas are balanced. In Chinese medicine, the vital source is called qi, and the balance of the polar energies, yin and yang. Yin, female, dark, cold. Yang, male, light, hot. Humoral medicine, early Western medicine developed by Hippocrates. And humoral medicine theorizes that the body has four fluids or humors that cause illness when out of balance. And the four humors are blood, yellow bile, black bile, and phlegm. Within the naturalistic explanations, there's also germ theory, which is the cornerstone of Western medicine. And it proposes that microorganisms are the cause of many diseases. And this has led to development of antibiotics and modern sanitation and hygienic practices. Germ theory also theorizes that the causes of illness include injury, parasites, malnutrition, hormonal imbalance, poor organ function, organic breakdown, etc. Now let's look at different definitions of illness. Illness is often defined as sickness of body or mind. And the definition varies from person to person. Feeling ill, sick, or unhealthy may or may not be related to an actual disease. The term illness and disease are not interchangeable. Disease refers to abnormalities of the structure and function of the body organs and systems. Diseases are universally classified with regards to symptoms and clinical presentation. So, for example, heart disease, the signs and the symptoms of heart disease are universally recognized. It will give the same diagnosis in India, Britain, the Caribbean, the US of A, universally classified and recognized. Health professionals determine a patient's state of health by the client's report of symptoms, diagnostic results, and observational data. In professional schools, one is taught to determine what is illness and how one is expected to behave when ill. Now let us look at the sick role. A person is expected to have these symptoms and perception of illness confirmed by a healthcare professional. The sick role must be confirmed before it is accepted by society. Therefore, illness is not only a condition, it is also a social role. There are four main components of the sick role. The sick person is exempted from performance of his or her normal social obligations. The sick person is also exempt from certain type of responsibility for his or her own state. The legitimization of the sick role is, however, only partial. Being sick, except in the mildest cases, is being in need of help. And many of us fight the sick role. We go to work sick, we push through being sick. So let's talk about the illness experience. The stages of the illness experience. 1. Symptom experience on onset of illness. 2. Diagnosis by a practitioner. 3. Patient acceptance of diagnosis, assumption of the sick role, and adjustment to the illness status or condition. Recovery or rehabilitation from the illness. The experience of an illness is determined by what illness means to the sick role. Illness refers to a specific status and role within a given society. It must be sanctioned by the community or society structure of which the person is a member. All cultural groups have a view of health and illness which may or may not be acceptable or respected by Western practitioners. Healthcare professionals should assess the person's worldview and tailor the approach and communication to successfully prevent and treat illness.